Hello, everybody. How are you?
Hello.
Hello.
Thanks for joining me today. Today, we're just going to talk about some things in honor of Black History Month, things that pertain to the Black communities and HIV. So, first, I would like to start by introducing myself. My name is Jordan Barnes. My preferred pronouns are he, him, his, and I'm the Community Engagement Coordinator for the STD HIV Hepatitis Program. And we can do like a little round robin. Whoever would like to go next, please introduce yourself.
Well, hello, everyone. I'll go next. My name is Rochelle Cole. My pronouns are she, her, and hers. I actually work in testing, in promoting testing as well as preventing STI transmission and reducing adolescent pregnancy at the Louisiana Department of Health. I'm passionate about ending the HIV epidemic here in Louisiana, specifically in Baton Rouge, as it predominantly does affect a large number of African-American women as well.
Hi, I'm Jasmine McGarry. I'm actually currently working on my graduate degree, a Master of Health Education and Behavior, and I'm definitely excited about having this conversation, as education is important in order to even prevent a lot of these diseases that we're going to be talking about today.
Hi, everyone. My name is Mari Jerome. I'm the Health Promotions Coordinator with the STD, HIV, and Hepatitis Program.
So let's just start out by asking, what does Black history mean to you?
Black history means to me endurance, perseverance, excellence. We are culture. We have created so many advancements in the world. I even think about civilization. We understand that, it was Black people who taught certain Europeans that they should bathe every day. The first academic universities were based out of Timbuktu in Africa. So Roman emperors would send their children to be educated in Africa. Black history is diverse. It encompasses everything. I don't know, I could go on and on, guys, but it just speaks so much to a group of individuals who were given so many challenges and overcame in every aspect, in everything, and gifted individuals. I'll stop rambling.
To me, Black history means just telling that story, like learning about who came before us and what they went through, the fights, the challenges, the battles that they faced every single day just because they were Black. And being able to pass that down by generation, teaching our kids, our nieces, our nephews, whoever, our family, about what our history was and how we can start, making sure we're in the right spaces and making sure we're still fighting for our rights and continuing to say, hey, we're here, we're Black, and we're proud of who we are.
And I'm seconding what Jasmine mentioned. So Black History or Black History Month, what it means to me is just, it's an opportunity to recognize and spotlight all of the accomplishments and the experiences of the Black community.
What Black history means to me is basically just that moment to sit back and appreciate all of the accomplishments that all Black communities have made. And it also gives us a chance to recognize and see how broad Blackness is. Even thinking about like what I was learning for Black history as a child, like now that concept is completely blown away. Like it's not just Martin Luther King, Rosa Parks, like it's beyond that. Like it's people who are making history today. Like it's watching and seeing how people are planning on creating history and creating like this future for Blackness and what Black history means. And it's important, I think that this month shows you how, even though we only celebrate it within a month, Black history is American history and it's 365 of the year, like everything that we partake in has to do with Black history in some kind of way, especially in America. Why is it necessary to know Black history? I believe that it's necessary to know Black history because what we are taught in America, I feel like, is not the full scope of what Black history is, right? And I feel like what's so important about learning the full scope of Black history Shout out to my alma mater, Xavier University. By learning all the history, come on, yes. By learning my full history, I know my full potential. First thing I learned about being Black was that we started out as slaves, and that is not the reality. Like when you learn that, you come from Africa and like from kingdoms and like queens and kings and full on villages and technology and how like what was stripped away from us as a Black person. I think is really necessary to know my history so that I know that I'm not just starting from the bottom, but like the shoulders that I'm on today, how much further I can go, and it's rewarding to know like what history means.
It's necessary to know Black history. Piggybacking off what you were saying, Jordan, I think learning Black history is important to gain a better understanding of the contributions and the trauma of a group of people of our community that is often misinterpreted and misunderstood in a historical context. So Black people are often depicted as being, in some instances, as lazy, dependent on government aid, violent, and there are just far too many significant contributions to this country that are overlooked. So it's definitely necessary.
I think even from like a health or medical standpoint, it's necessary to know Black history. You get to know like how these things are passed down when it comes to traditions and the way we eat, the way we discuss certain conversations, even around sexual health. Like knowing what our history is and what we weren't able to do, what we weren't allowed to read or allowed to educate ourselves. So for years and years, there's just that lack of knowledge that hasn't been passed down. I think it's necessary to know, just so we can know we can do better.
So thank you for that answer, Jasmine. So what makes you proud about Black history or Blackness? Like what makes you proud?
What makes me proud about Blackness? Y'all, I'm gonna just say this. Sometimes I wake up and I be like, I thank you for making me Black. I'm just gonna be honest. There is no other culture I would want to be. And that goes on to the way we gather, the way we interact with each other, that feeling of family when you're in a room with many different races and you see one Black person and you feel, oh, hi, breath of fresh air. Blackness, it's unique. We have the most versatile hair. We have, I think we're blessed in our skin tone, our ability to almost seem to not ever age, our beautiful facial structures, our hair. We can pull off any single thing. I think we're trendsetters in everything that we put on. It's just beautiful to know that we're so diverse, and even the difference in our melanin still makes us connected. You can be Black and be any tone of brown.
What makes me proud about Black history and just Blackness in general is almost what you were saying, Rochelle, the ability to create. Like when I look at Black people, when I think of Blackness, I think of creativeness. I think of innovation, like creating ways out of no ways, or like seeing issues and coming up with solutions, even though resources may not be there. I love how mixed and complex our history is. I love, like everything, love everything about us. And I also love that in 2022, I feel very comfortable with saying that. I don't think that it was something that was always okay to say, or, or at least like from my childhood, just not remembering, moments where I was like, proud to see myself, and now I can like turn on the TV, I can see myself, I can walk in spaces and know that like I'm commanding it with my skin alone. And it just makes me feel really proud, Of course it comes with like a lot of baggage, but I'm so glad we're in a space where we're willing to work on it now, and we're very conscious of that. So I'm proud of everyone who came before me. I'm proud of everyone that's with me, and I'm proud of everyone that will come after me.
Y'all are just preaching in here today. I have nothing else to say. Speech.
Yeah, perfect.
All right. So moving on from like what makes us proud, because again, like me and Rochelle could go all day. What is HIV and what does it do? That simple question.
I would say in the simplest form, HIV is a virus. It's a human immunodeficiency virus, and it depletes your CD4 T cells. These are the cells that fight off your viruses, fight off your infections. And so it makes people who do contract the virus more susceptible to infections such as tuberculosis, pneumonia, and a lot of diseases actually. And it can lead to a further progression into AIDS, which at that point, your body, it can become fatal.
So, transparent moment. I have always been in the field of art. This in the last year has been the first time that I've worked in anything health related. So I am still learning about all of the specifics and the details. The basics of what I can tell you of what HIV is that it's a sexually transmitted disease. And what does it do? That question kind of confuses me about what does it do?
And that's a very human moment, because honestly, like what we know about HIV is not really what HIV is, right? Like we hear, oh, well, what we have heard was, oh, if you're gay, you're gonna catch the virus. Or like if, like we have never like really dissected what this virus is and what it can do. A lot of people may say, oh, that person, oh, because they have like pneumonia, they have HIV. And that's not necessarily the case. What people don't understand is that HIV is not necessarily what kills you, but the fact that HIV takes away or attacks your immune system, any type of infection that enters your body can be great. So even something that's like, that would be normally small, like a cold or pneumonia that your body can fight off, it now cannot because of this virus that's attacking you. Thank y'all for that answer in that very real moment. Only 32% of Louisiana's population are Black, but yet they make up 70% of new HIV diagnoses in 2020. How does that make you feel, and why do you think that is?
Those statistics, they kind of hit close to home for me whenever I hear that there's a disease that disproportionately affects Black people. It always makes me sigh. As a matter of fact, the first HIV test that I've ever administered, it was a positive result, and it happened to be someone who was like 18 years old and he was Black. And that's what kind of made me know and become passionate in ending HIV, because for some reason I just felt connected, to this person. Maybe it was because he was around my age at the time. I don't know, but it's disheartening, and it's not an easy statistic to swallow. Knowing that there are people out there that you interact with, these are peers, and that, they're going through something health-wise, something that, is life-changing.
For me, I think those statistics about HIV and how it's more prevalent in the Black community in Louisiana, it definitely validates my passions and want to go into health education to provide more prevention and promotion and all these efforts to make sure people are educated about how to prevent it and what to do and what are your steps and who to talk to about it. Because I think that's a big thing. We don't know who to talk to in the Black community. It's not something you go home and talk to your parents about. Oh, I might have just had sex the other night, and I think I didn't use a condom, or things like that. They don't come up naturally in the conversation, I think, within our community. And so it pushes me to want to keep doing more.
When I hear those statistics, I'm always like, what? How did this even, how did we get here? And what is it that other ethnic groups have that we don't? I really, my mind starts to malfunctioning, because I'm like, how is this even a thing? And you see how many how much effort is put into like the Black community to like at least try to educate. But I think the mark for some reason is always missed, and it's something that I constantly like question myself, like what work could we be doing to better reach Black communities. And I understand that there may be institutionalized racism, there are barriers to getting access to treatment. There's also a lot of stigma that's surrounded in HIV and also sexual health. I think, you know, even with religion, not necessarily, you know, not necessarily faith, but, you know, like the people in it that kind of take people away from like health and actually going to the doctor and caring for yourself and getting checked up frequently, you know, I think gets in a way of us being as healthy as we possibly could be. But those numbers make me uncomfortable, you know, especially when it's in 2020, when there's so many resources like PrEP, there's so many resources out there like condoms, even just talking to your partner is like, you know, before we even engage in anything, can we just have a conversation about like what you've been doing? But it's so taboo to have that conversation. So it's alarming to me. I guess I get it, but it just should not be in that magnitude.
I don't know. I mean, talking about that, Jordan, realistically, we're going to have to start looking at other measures outside of condoms. I mean, I know they came out with the injectable PrEP. That may be something. Even testing, like it's anxiety for people to even go and get tested at a certain like community-based organization. They don't even want to take that trip. Or if they don't want to take that trip, let me back up, because people love to put the blame on the client. Lack of transportation issues can impact the ability of a person who knows they're going to be intimate with their partner. But if they don't have the transportation to make it to get their test, you know, you got to have like, is it an at-home HIV test kit that you can give? And not only just HIV, just like STIs, like, is there something like, it has to be literally that available, I think, for us to see that turn that we're hoping to make. Because there's so many factors that play into lack of testing and in, you know, lack of using condoms.
Just to be honest, I know in 2022, condoms have to be made into a lifestyle. I know that. I know a lot of people would just rather not. But you know, like I think that there is a conversation to be had around making condoms a part of sexual health, and I think, you know, not again. I also hear what you're saying. Like it's an entire system, not just that person, but and also I think that if we could at least normalize a conversation, at least you can plan to have sex. Like I know a lot of people, like, you know, they walk around without actually admitting that they want to be sexual beings. In doing that, when you don't accept the responsibility of being someone who is a sexual being, you also do away with the responsibility of preparing for sexual encounters. So you're not carrying around condoms. You're not, you know, doing things that would protect you from HIV, you know. If I feel like if you assume that lifestyle, or at least have that conversation with yourself, like, okay, I know this is something I want to do. Let me just make sure I'm prepared. Then you can start doing things that can meet you before you actually get to that moment. But also to your point, I think that a lot of the testing facilities, not to say that they're flagged, but you know, like even sometimes it's difficult for people to even go in the clinic because they don't want to see a familiar face. They don't want to, like, you know, they don't want to have all the conversation. They don't want you to ask about the family. They just want you to give me the test and let me go. You know, like, give me my result. It should be something real quick, you know. But I think, you know, we don't have that happy medium too. So I'm not saying all of it is bad. Some people actually like that community, but some people don't.
Yeah, just speaking on testing, I know like here in Baton Rouge, some things I've wanted to like bring to CBOs is like some of the bars and the clubs, like as long as you can make it discreet and you can have like even if it's an unmarked van or something, like you can get some of these people that can come out and they'll take a test. Because I have been in clubs recently and the DJ was like, if you know you don't have HIV, put your hands up. Yo, the entire club put their hands up. So me, working in the department that I work, I'm looking around like, oh, they got testing going out outside. A lot of y'all saying, y'all know y'all good and stuff. Like, is there testing going on? But I'm like, people are so happy to advertise that. But when is the last time you received the test? Is it in the last 6 months or year? Like, so I definitely feel like we have work to do around, I guess, innovatively bringing testing out. And it could be a popular seafood restaurant that everybody's going to be at on a certain day. Like, it'll have to be something like that. Like, I literally can go to Walmart and I can see one of the CBOs out there testing and say, oh, I could get my test right here.
I wish we could get to a place where we normalize positive STI results. Like, it is a thing. It is a very normal thing in our community. Like not saying it is something that we would like to be normal, but the reality is it is. Like, our community is suffering, you know what I'm saying? And it's not something like our community is not walking around here like without HIV. Like, we are. You know what I'm saying? Like, it's something that is in our community and we should normalize it. Like, people are living healthy lives with HIV. So let's not get the test. Like, you can get the test, see what your results are, and be proud about whatever that result is. You know what I'm saying? Like, if you're living with HIV, that's what it is. You're living with HIV. Let the world know. Be healthy in that. I know I'm saying that from a very privileged space, but like, I feel like if more people were like, oh, I can get screened, and if I know if I have HIV or not, then at least whoever I'm going to be engaged with, they can know, versus like me not knowing and then someone else like contracting HIV because I didn't know my status, So I'm just like, let's just normalize, if you're positive or negative, either way, let's just know, like, I wish we could get to that place. And I think that could be transformative within our community. Stop shaming people.
Yeah. Someone said to me, they disclose their positive status and the first thing they hear is, oh, I'm sorry. And they're like, I'm thriving. Like, I'm in my career. I'm doing great. Like, why do you tell me that you're sorry? Sorry for what? Like, I'm fine. And so I think you're right. Stop shaming people and blaming people for something that's ubiquitous. Like, this is everywhere.
What can we do as a community to break through these barriers?
Honestly think we just touched on it in the last question. Personally, I feel like as a community, we need to, how can I say this? A lot of the times, the Black community, we don't speak about things. And I think the most important thing is to have a conversation. And I think for us, we like to look to people we can trust. So I think we need trusted sources to actually, like you said, Jordan, don't shame people who have a positive test. I think we need to just have more conversations publicly, not just in the healthcare facilities, not just with the people in the direct community, everyone, even the community members who aren't affected by HIV directly. I just think to break those barriers, everyone needs to have the conversation. I think an open dialogue is important to breaking barriers because a lot of the times we don't know. Like the question that we talked about earlier of what is HIV, a lot of people have a basic knowledge of what it is and just a Google definition. We don't really know all the details. So I think we really need to have open and honest conversation with everyone in our community.
I think in terms of what the community can do to break these barriers, similar to what Rochelle said about making it more innovative, making it more accessible. Like you said, maybe they don't want to walk into a testing site. They don't want to see somebody they know. I think it is a great idea, like what she said, in terms of making it an at-home test. I would have never thought about that. That is super creative. People can feel comfortable to do it at home with their partners. Then they can have a discussion about those results. And the more you make it normalize and part of everyday conversation. You can talk about with your peers, talk about with your family, and they can all be motivated to get themselves tested. Like we do it for any other disease, any other problem that's going on, we push it. It's promoted in churches, promoted in schools. They have, donation buses. Like, why can't we have that same thing, like what she said about for HIV, having it outside of different locally popular places to go to?
If we can talk about it, I think that is the biggest barrier. And maybe this is just, I'm only speaking from a Black queer man's perspective. I don't know what other ethnicities do or what other groups do, but I know that we get really uncomfortable when we're talking about health and what we should be doing with our health. That's just like what I've experienced, and I think if we can get in a place where it's not just, oh, you're learning your result, but like if someone knew, like if someone had already known about the different prevention measures, and also once someone does contract HIV, that there are advancements in technology where you are only taking one pill a day and you're not even showing any effects of what HIV can do to your body, right? We call that U equals U. Undetectable equals untransmittable. So like you can take an HIV test and it not even show up, you know what I'm saying? Because you're taking your medication every day. I feel like if our community was just more aware of the resources that were out there to be healthy, then it would further push them to get screened. Like, look, like it's okay. Like I'm not gonna judge you. And to be honest, there are so many people who are living with HIV that are not vocal about it. But if you knew, you would be like it would completely, even that barrier alone about like only using maybe like 3% of the population that is living with HIV to speak on HIV, I feel like is a barrier. If we could get more people who are living with HIV who can speak for it and not just like, the pharmaceutical chosen few, but like an entire community of people like showing you different lives. Like I don't have to do the marches. I don't have to like be a poster child. I just want you to know that like when I go to work, when I do my, like I'm a construction guy, I'm living with HIV, and that's like, like it's not even a thing. Like it doesn't even show up in my mind. I take my pill and I keep it moving. I just wish there was more, again, that normalized community around it. Then maybe we could get to a place where it's better.
It's going to take some time though. I mean, if you think about, Black culture and what we pride ourselves on, I think in the Black community, we have such a strong tie to religion, as well as, especially in the South, being hospitable and having manners. I think that before someone even goes to take an STI test, in the back of their head, they're thinking, maybe that's not activities you should have engaged in, sexual activities. And so we have a real disconnect, I think, and I can only speak for our community, but I'm not saying any others don't have the same work in just sexual education and letting people understand, like, you're not at fault for your sexual practices. Because I think that's what kind of limits when we start having this conversation around being sexually healthy. You don't even want to have that conversation because you automatically tie that into your own behavior. And so I think we have a lot of work to do just in the Black community and in our households, I think, in educating people in, sexual choices and stop judging and stuff. Just saying, not saying no other community does this, because there are a lot of other religious communities out there, but I can only speak for just in our Black household.
I think that you nailed it, because I think that it's super unfortunate that, and who knows where this stemmed from, that we don't feel comfortable with having those conversations in our household. And I don't know if we, as a community, need to start providing support groups or groups for parents to be able to have those conversations, just like they teach sexual education In the schools, maybe there needs to be an outside resource for parents to get that conversation started in the household and to let the parents know that this isn't something to be ashamed of. These conversations need to happen. Testing is okay. But see, a lot of the times parents may think, oh, I'm joining this group because, oh, my child must be doing this. No, we just want to prepare you now so that when the day comes, you know, if they start getting sexually active, everyone in the house will have the resources. So I just think there probably needs to be more resources for the parents, because a lot of the times parents are only doing what they were taught before them and the parents before them. So maybe there needs to be more support groups initially for parents, not after.
Definitely. And I think there are, so like, I know that some programs try to educate the parents, but again, like moving into 2022, we're understanding that our children and even us are just more sexually liberated beings, you know, and we are experimenting more. And I think now, like with the type of sexual education that is primarily promoted, it's one, heterosexual sexual education is not talking about all scopes of sexuality. I think that is also something that's really important. And this is just speaking from me, from my like personal experience. I would love like envisioning like my child having sexual education. I would want them to learn about everything. So like these are a couple things that you can do before you actually have sex, right? Like you can do this, you can do that, you know, spend some time doing this, you know, like maybe you want to like, I don't know, you know, like y'all can cuddle or something like that before you actually get to like sex, you know. And I think it's, at least what I've experienced, it's been like all or nothing, at least like what I've learned, right? So like either you're not doing anything at all or you're doing everything. And I would love for our future generations to learn about the in-between. And I think they are learning it by themselves, but I think it would be better if there was like some kind of like structure around that education versus just like having your child go on Google and finding everything out, which isn't bad, but sometimes they learn about things that need a little bit more explanation than what the internet can provide. So what are ways to reduce your chances of contracting HIV? And there are plenty.
In terms of ways to reduce your chances of contracting HIV, I think one of the biggest things, like mentioned earlier in the conversation, is condom use, whether it's male or female condom use, making sure it's readily available, and that there's actually education surrounding the proper use of it, making sure it's not expired, making sure there aren't any holes in it. Then that's also that opens up the conversation into drug use and making sure you're not sharing needles and utilizing needle exchange programs. And if it comes to women's health, and make sure you're treated so you're not passing down anything to your children through pregnancy or through the birth canal as well.
I will say for me, I think my biggest way of preventing HIV, one, I'm almost like, I like to test medication. So like I was a part of the pill prep and I was also like part of the shot prep. So I'm on the injectable prep as we are speaking, and I don't have any extra limbs growing on me. So it's good to go for now. But I think PrEP is a great way of preventing yourself from contracting HIV. And also just the conversation, like talking with your partner and making sure that y'all can at least talk about your sexual history together is a great tool to use to prevent your chances of contracting HIV or reduce your chances of contracting HIV. Any other ways that y'all can think of? I got like 7 on the top of my head.
So you already mentioned PrEP and condom use. I would say testing. We said that already as well, I think, but no, not saying go and get tested to ensure that you don't necessarily, you know, that you aren't living with HIV, but just having that relationship with your provider can let you know, if you do have HIV, and you can get started on treatment, and it will be virtually impossible for you to transmit the HIV virus to your sexual partner once you stay on that regimen. So it's all about just being healthy, staying in care. And I know that's difficult, to say. Everybody can't afford to do those things, but I definitely think that's a way to prevent, HIV, is by being wise about your sexual health.
So I'm going to include some other ways that you can reduce your chances of contracting HIV. Abstinence is like the absolute way to prevent your chances of contracting HIV. Abstinence. And receptive anal sex is like the most at risk way of contracting HIV, right? So like everything in between are ways to like reduce your chances of contracting HIV. So it could be like mutual masturbation, oral sex, being like someone, using lubricant is a way of reducing HIV, because if you are reducing friction, then you are by then like reducing your chances of opening up any type of not wound, but opening up any type of exposing any of your pink parts in your body. So like basically the way that you can become infected is if the virus gets in your body some kind of way, right? Also, I know some people don't know about this, but if if you before like any sexual encounters, if you do plan on having oral sex, you should not brush your teeth an hour before or after. You use mouthwash, because when you brush your teeth, you open up your gums that can then allow infections inside of your mouth. So these are just a couple things that that like you don't normally think about when you're having sex, but like, or getting to that point of having sex, are like ways to reduce your chances of contracting STIs. So make sure you use your mouthwash, and don't feel bad about not brushing your teeth. Thank you all so much. Did anyone have any like last burning things that they wanted to say? All right. So thank y'all so much for joining me. This was great. And yeah, thank y'all.